Hi, I'm Dr. Shah with 360 Urology. We're a practice located just 15 minutes outside of Atlanta in Stockbridge, Georgia. I'm here today to talk to you a little bit about PSA screening. Now, there are a lot of misconceptions on PSA screening, so let's see if we can clear that up for you. Now, a couple things to note about the prostate. Prostate itself, as you get older, has two general problems that frequently occur. One is the prostate gets bigger, and the other is the prostate can become cancerous. And prostate cancer in general is the most common cancer in men, and the second most common cancer killer in men, second only to lung cancer. So it is an important cancer. It's a cancer of the elderly. There are two problems of the elderly in men that commonly occur. Again, prostate's only in men, right? If this is your bladder, this is your prostate right at the opening of the channel that you pee out. And as you get older, this prostate starts getting bigger and bigger. And as it gets bigger, it blocks that channel. That is a problem of the inside of the prostate, and that's called enlarged prostate. Now, prostate cancer usually occurs on the outside of the prostate. And why does that matter? Well, when we do a rectal exam, so we use a rectum kind of next to it, we stick our finger in there, use your nail, and we push down on the colon wall, and we're feeling through the rectum, and we're feeling for any nodules that may be there for prostate cancer. So a rectal exam is an exam of prostate cancer, not to measure prostate size or enlarged prostate. It's really meant to try to catch any nodules for prostate cancer. It's not a test that has to be done, but it does give some useful information. The most common way to check for prostate cancer is a blood test called PSA. Now, PSA is a protein specific for the prostate, so it's released by the prostate. And the purpose of PSA is for us to try to see if there's a risk of prostate cancer. Now, PSA can be released for a number of reasons, right? You just had sex and ejaculated, within a couple days of the PSA test. Someone did a rectal exam. You had a bladder infection. You went horseback riding, motorcycle riding, rode a lawnmower. Anything that's putting pressure on the prostate. All of that can increase PSA incidentally or accidentally. The other thing that can increase PSA is prostate cancer. And so if your PSA goes up and comes back down, well, maybe it was one of those other things that kind of, gave it that false higher reading. If it has been going up and up and up and steadily rising, well, then we worry more about prostate cancer. PSA screening is not a perfect science, and that's why there's a lot of hesitancy to use that test. We do have other genomic markers and other tests that we can do. Sometimes we implement MRIs and other tests that can help guide us if the PSA is high. But the next gold standard treatment to try to figure out if you have prostate cancer is going to be a prostate biopsy. Now, it doesn't mean we can't do other tests to help guide us on whether you need prostate biopsy, but it's more so to say, hey, let's figure out if you actually have prostate cancer. And a prostate biopsy would be similarly insertion of a probe like in the rectum, and we take tiny bites through the rectal wall, because the rectal wall doesn't have much sensation, and we take samples of the prostate. We do numb the prostate. It's an easy, quick 5-minute thing, and then we send the samples off, and in about a week or two we'll have your results and we'll go over it. That's about it. That's my talk on PSA screening. If you have any questions, I'd love for you to come in. We'd love to hear from you. If you thought this was helpful, let us know.